Welcome to this conversation with an industry expert. I'm Dr. Tobias Andreasson. I'm the Associate Director of Social Innovation at CQUniversity. And this conversation is with Chris Vanstone, and he's the Chief Innovation Officer at the Australian Centre for Social Innovation, TACSI. Chris got decades of experience in design and in social innovation, and he's been really leading how we understand social innovation as a practice, both in Australia but also internationally. So I hope you enjoy some of his insights. You can probably tell that we recorded this during COVID-19, so excuse any issues with the sound or video, but welcome anyway. Thank you.
My name is Chris Vanstone. I'm Chief Innovation Officer at the Australian Centre for Social Innovation. And TACSI, as we like to call it, is really we're a not-for-profit organisation, a national organisation that's really trying to demonstrate, discover and demonstrate what social innovation can be and the kind of value it can create, and create a better national context for that in Australia. We are a practitioner-led business in that we do a lot of work. Part of that is through consultancy, where we're supporting not-for-profits, supporting philanthropy, supporting government, and also some for-purpose business to really tackle the problems that are facing them now, whether that's at a practice level or a service level or a commissioning level or a policy level. We take on long-term systems initiatives, which are about working across all of those sectors and a lot of different levels to create the conditions for things like a better way of end of life in Australia, or changing how we live as we age, or thinking about resilience in communities, or improving local mental health. And the third part of what we do is about scaling innovation. So that's where we've developed particular service models or program models, things like family by family or weavers, which happen to be peer-to-peer interventions. And we're really thinking about how we can demonstrate the potential of those innovations, which we think are quite different from a lot of things that are out there at the moment.
Is there a way of just kind of capture what's TACSI's approach to social innovation in terms of doing it?
Oh, sure. I think the definition that works for us the best comes from the Open Book of Social Innovation, Nesta, and this idea that social innovation are social in ends and in means. And we like to break that down a little bit, but it's this idea that it's human-centered in ends and means. So we're method agnostic as an organization. Design is a big part of what we do, but it's not the only methodology that we're putting into use. But the idea of being really human-centered in your processes, but also in your outputs, and developing sort of peer-to-peer outputs would be an example of that. It's about being systemic in your ends and means. So it's really about thinking, seeing that complexity, and developing solutions that work through it, and solutions that themselves keep evolving, that aren't sort of single-shot solutions. And then it's about being experimental in ends and means. So experimental meaning to us that you're rigorous in your use of creativity, rigorous in your use of evidence, and rigorous in your use of learning. And I think social innovation as a discipline is in and of itself evolving. It's, in one hand, it gives a new name for something that folks have been doing for a long time, but on the other hand, it's really not as well defined as other disciplines might be, and it seems to be, certainly from our perspective, evolving every day. So there's that responsibility, I guess, to be experimental in your approach and share what you're learning to build practice on a greater level.
And do you think, what's your view on social innovation in Australia compared to other places? Are we leading it? Are we in a good place, or is it still kind of?
Yeah, that's a really interesting question, and people will give you different perspectives on that. I think on one level. On one level, there might not, at a sort of national level, you could argue, I think, that there isn't perhaps that it doesn't have the national profile that it might in other countries. For example, in Canada or even Ireland, where they've sort of made significant investments into social innovation. However, lots of practitioners from overseas will look with envy at what's happening here. And I think over the last 10 years or so, 5 years or so, there are a number of state governments that have really embraced the idea of co-design and co-production and engaging citizens in the development and delivery of services. And that's really exciting and doesn't happen to such an extent elsewhere. Certainly elsewhere, where a lot of Europe and certainly the UK has been under austerity measures, that is to sort of reduce the opportunity for that. And I think also philanthropy here, whilst it is relatively small to other countries, it has started to pick up and embrace more kind of social innovation type practices in some really interesting ways. And I think I think there are few leading organisations here that are sort of practitioners. I think that sort of suits with the Australian pragmatism as well, in that we're not sort of just talking about it, we're doing it. And yeah, I hope TACSI is playing a role, small part of one role in sort of defining what it can be and sort of leading the way.
Have you noticed, and I want to come back to hearing maybe a couple of examples of social innovation projects, so I think that could be interesting. But have you noticed a shift when you're talking to, because I know TACSI is doing a lot of work with a number of different federal, state government departments. When you work with those departments, what's the response, and has that changed in terms of how their appetite for social innovation?
Yeah, I think it definitely has shifted, and I'd say it has shifted over the last 5 years or so. And I think you'll see more. There are certainly particular states that have more socially progressive policies, you could argue, and are more likely to put citizens front and centre in the development of new services and policies, and have built internal capabilities to do that. So some states have got very sophisticated in their requests as they learn more and more and build that internal capability. I think there is also a significant degree of business as usual, and a significant degree of people perhaps using the language that might suggest social innovation, things like co-design, but using that in a very loose way without really understanding what that might mean, or using it to mean, for example, in that context, consultation by another name. I think what we're not seeing a lot of is, and I hope that will be a next step in Australia, is really taking a more holistic view. So rather than ghettoising social innovation approaches within sort of a social welfare context or a social policy context, taking a more holistic view, because we know what disrupts disadvantage is a more multidimensional view that takes into account the economics, the environment, people, and their sort of social welfare, and helps those things to work together. And I think, and I'm hopeful that some of the push via recovery work will enable that to happen. Yeah, absolutely. And I'll give you some examples at a few different levels as well. I think it's social innovation is and needs to be lots of different things, and I wouldn't pretend for a minute that TACSI practices the full breadth of social innovation. We've got a particular strength, I guess, in what we kind of term as sort of people-powered innovation, that kind of participatory approaches. But people are always important in social innovation, as the term implies, but you can kind of work with, there are more data-driven and harder approaches, I guess, that we are only starting to get into. So one example from a practice and sort of service level would be work that we did in Queensland with Brisbane South PHN. We've done a number of projects with them, and they've got a strong commitment to participatory development of health services, and in particular mental health services with lived experience of mental ill health. So in that project, we worked with a number of people who had experienced moderate level mental health services to develop a high level framework, so what they called a philosophy of care, to define what kinds of services should be commissioned by the PHN, and then to identify and develop some particular outlines of service models that were then used to commission not-for-profit organisations to develop services within that philosophy of care, starting with those models developed by citizens with lived experience of mental ill health, and then also to help those organisations take a good participatory process in their detailed design of the services. So that's one example of a project where we developed what we would call a participatory design team that consisted of people with lived experience of mental ill health, in this case, clinical practitioners, and sort of management and leaders and commissioners from the PHN itself. And they work together through a process, coming together in workshops to make sense of this current situation, to define a preferred future state, and then to work out practically how could you bring that alive within their system. So that's a sort of, I guess, sort of service commissioning type example.
So in some ways as well, if we look back at the definition, it's nearly more about that social innovation that's it's innovation in its means and in its ends. So it's kind of in the means there. It's in the process. It's in the way of working together.
That's right. That's right. You're bringing together people, and critical to that is that you have to build trust and respect, but also you have to balance power to the extent that you're able. So how peoples who have experienced marginalization on a daily basis, you've got to think carefully about how you might bring them together to work with professionals who might be, sort of high senior doctors or clinicians, and who are used to people doing what they say. And it's about as much kind of preparation work needs to be done both sides of that to enable a good and safe space for folks to come together. And to be creative. Examples, we can talk about maybe our systemic end of life network. So this was built off a piece of research that we did for a foundation that was looking at making investments to improve the end of life experience in Australia, and we really identified that they had a hunch that there was this one particular intervention that they should fund into, and we did a little bit of investigation to show that actually there's lots of innovation out there in end of life in Australia, but it's not necessarily connected, and it's not connected to a sort of shared vision of what the future would be. And actually, there's lots of different kinds of poor experience of end of life, and that particular kind of intervention, death literacy, wouldn't address all of them. So over the last year or so, we've been running something called the Strategic Innovation in End of Life Network, and the purpose of that is to build, again, more of the social, to build connection between innovators in end of life across Australia. So that would include clinicians, hospice type settings. It would include funeral industry. It would include alternative funerals, as well as sort of individuals and community groups that are thinking or have been doing things differently. Helping them to learn about each other's work and helping them move towards a shared vision and to reorientate an element of their work to address some of the systems conditions that are holding the problem in place. So the role that we're playing is much more a kind of connector and facilitator of others' innovations and a little bit of support and direction, but with the aim of creating this quite significant shift, if you think about it, in what does, how can our end-of-life experiences be better? And we know that most people die in hospital and most people don't want to die in hospital. That's just one kind of one statistic to illustrate how things might need to shift, and then the shift that people would like to see, but the shift that's only going to come if we focus on some of those system conditions.
And both of these examples are, rather complex, and they require a lot of facilitation and networking. But I know as well that TACSI's got a lot of background in designing new kind of services and more than traditional, I guess, a social innovation. Is there a good example of that? Something that
Yeah, absolutely. So from our scaling innovations team, and this was one of, was the first project I worked on at TACSI 10 or so years ago. And this was about creating again, taking a participatory process, or perhaps more of a human-centered design process in this case, to design a new kind of support for families. And the question we started with was, how can we enable more families to thrive and fewer to come into contact with state-provided crisis services, particularly child protection services and things like that. And this wasn't, to contrast it, I guess, with that Brisbane South work in mental health, this wasn't about designing something that would naturally fit into existing service systems. This was about demonstrating that something different was possible. So it was very much led by families, and we worked with over 100 families over about a year to understand what family life was like, what helpful help looked like to families, and we learned that more often came from another family rather than a professional. And so that was that first part, the discovery part of the process. And then understanding that, we thought, well, then we should try and develop and prototype some kind of peer-to-peer service that really enabled the mobilization of families to support other families. And that was building on some positive deviance we'd seen where families were doing that, and doing that without any structure around it. And our hypothesis was that, well, if we provided a little bit of structure, we could enable this to happen for more families. So we prototyped that over 20 weeks with 20 families, so quite rapid prototype where we were delivering service to families who were looking for a bit of support. And now we've been running that for 8 or 9 years in South Australia and for a period of time in New South Wales as well. Lots of refining and tweaking along the way, and recently have supported our partners to a not-for-profit organisation to take on the model, and currently we're in conversation with organisations in Australia and New Zealand and the UK as well to explore them taking on that particular kind of model. So it's, I think the really interesting thing about Family by Family is that it was designed to be what families wanted, not what the service system wanted. That's presented real challenges in its scale, because the kind of outcomes it creates are the outcomes that families want, and they're broad and across the board. And so it's really good value for money, but government tends to fund in sort of particular silos. It doesn't create enough of any particular kind of outcome to get really fit in neatly to a particular box. But we've had great support from South Australian government over the last 8 years to keep it going and develop an evidence base for it too. And we're just on the verge of going into a controlled wait list randomized control trial of the model to develop some quite rigorous evidence for that. So. And that project, I think, sort of speaks to those stages of one way to think about the stages of social innovation, in that you're sort of starting in some sort of discovery space where you're learning about opportunities. Then you're moving into a design space where you're developing a new model, a trial space where you're starting to develop evidence about that model, and then a spread space where you're trying to maximize the impact of the model. And whilst we are supporting other organizations to take on that model, we've also recognized that it's a particular kind of model, and actually some of the principles behind the model and some of the patterns in the model will be equally or perhaps more valuable or more broadly relevant. So we're also thinking about how we can, instead of think about spreading the model as a sort of all-in-one kind of buy the whole thing, how can you get the recipe and build your own version that fits into your own organization?
I think that is a nice segue into asking a bit about the teams in terms of working in social innovation. Because I mean, at CQU, we've really focused on social innovation as something that should be kind of implemented across the institution and within the education. It's one part of it, but so there's a few questions here probably, but I know the TACSI really values the interdisciplinary teams, and I think just we try to do that at university, but it's really hard because universities are very siloed. But in the sense of, just a comment about why, when you looking for people to employ in the teams, that what is it that drives the interdisciplinary part of it?
Yeah, no, it's a critical, if not the critical component of it, Tobias. So I think when we put together our teams, when we're looking to kind of bring together our people, we're really looking for people that have that sort of driving social purpose, and no surprise there. But there are a couple of other things that are also really important. Another is humility. So a willingness to say that you don't know something, and a willingness to learn from others, and a willingness to put the work first rather than your own ego in that work. And that's a sort of prerequisite, I think, for interdisciplinary working. Because that can be really, really hard for people. And so we do a lot of work to, even though we're starting with great people, we do a lot of work to further build that trust and connection at a person-to-person level, so that people are feel able to reach out and say, I don't know what's going on here, or I'm unsure about this, or can you help me with this, and trust their colleagues in that. But we know that it can be, often folks are moving from a place where they've been a real specialist in a particular discipline. So whether that was social work or design-based innovation, or in the government setting or a not-for-profit setting, and you're moving into a social innovation space, which is trying to recombine disciplines in a way that is somewhat defined, but not yet totally defined. And the discipline itself is evolving and emergent. And so I think there is often there can be a degree of professional anxiety that comes because people are like, whoa, I thought I was really good at what I do, and now I see all of these other ways of doing things that I haven't been exposed to before, and I don't quite know where I fit in there, and have I got something to contribute? And that's that can be the sort of flip side of interdisciplinary teams.
Mm.
I think it is important, and those principles I listed out of being systemic, experimental, and human-centered. Those are, I guess, the crunchiest level to which we try and define our approach. So they're the anchor points, and there's lots of different ways to be systemic, or be human-centered, or be experimental. But we do try and some degree of shared language and some degree of a significant number, I think, of principles about how you work together and how you do the work are pretty essential.
And how do you go about, because I want to just move along a bit, because I think so much we could probably unpack, but just to jump into the education part, in the sense of, you've already mentioned some of those kind of mindsets that's required for someone to work effectively, I guess, within in an interdisciplinary team doing the social innovation. And that's at CQU, that's something we, we're thinking about, how can we get people in all the different disciplines to acquiring these kind of attributes or attitudes or skills that not necessarily to be a social innovator, not necessarily to work for TACSI, but to just be able to be a citizen nearly that can actually contribute to some of this stuff. So in your work, I mean, I know you're involved with the capability building of the TACSI team, and you've been doing it for a long time, and you're designing learning experiences for them. Well, how do you go about building those capabilities that you see are needed for social innovation, or building those mindsets? What's your approach to that?
Yeah. And I think 10 years in, we're only really starting to get to grips with that. I think sort of because it is so broad, and we've had particular biases in the past that perhaps have sort of prevented us seeing the bigger picture. I think something that's really important is practice. Like it's social innovation, because it's working with such complexity. It's so applied that I think you've really got to have that. I think it's hard to do in the abstract. You've really got to get to grips with what it means in particular contexts, and how principles might play out in particular contexts. So I think our learning at TACSI works at a number of different levels. There's sort of regular reflection and sharing on project work. There's regular evaluation of our own work according to our own criteria in order to identify where we're making a difference, how we're conducting our work, how we're executing it. Are we doing the right work in accordance with our strategy? And then we have just started a sort of foundation course in social innovation that is a combination of podcasts and written material and sort of reflective discussion that's really trying to take the next level down on those principles. So what does it mean to be human in means and ends? What does it mean to be systemic in means and ends? What does it mean to be experimental in means and ends?
And what's do you have an example? Because I think that's what a lot of people are struggling even within higher ed. You may have someone in engineering, and we're asking them to embed social innovation into what they're doing, and they are really, they're technical. They're very focused on their thing, and we kind of, the push is to make them. We need those students to not just be technically proficient, but to have some of those, I think, abilities that you're talking about on a different level. But how do you go about building those or nurturing those within teams? And I know we did, TACSI developing teams within governments as well. So,
and I think it is working out, and that's perhaps the sort of education piece, is working out what those principles might mean in a particular context. So when the kind of training I describe is quite generic, because it's for the TACSI team who work across a lot of different things, but the more helpful, I think, training for that we're developing concurrently would be things like, what does social innovation look like in a mental health services setting?
Yeah.
And I think when you get it specific, then you can start to think about those. When you get specific, you can start to think about what does that mean. But there are, I'm just pull them up here, but there are a set of questions that we developed off our own internal training that I think might be quite interesting, because I think they give you the questions that could be applied to any setting, even if the wording from them might be a little abstract.
Yeah, that'd be great.
And so this comes from just a bit of a breakdown of that framework, systemic, experimental, human-centered. And so I think these are some of the questions that you can apply to any given project. And the first one might sound surprising, but it comes from that human in means. So am I and my team in our best place to do this work right now? So recognizing that, we're all practitioners, unless we take care of ourselves first, we won't be able to do that broader work. What are the social outcomes for this work for individuals and society? So getting really clear on what you're trying to achieve through this. Thinking about the systems that create these outcomes, whether they're formal or informal systems. What does effective and healthy participation look like in this project? So if you're involving members of the public or beneficiaries of the whatever you're designing or creating, to what extent are they involved? What are the systemic actions that will create change? So what can you actually do to prompt broader change? What does experimentation really need to look like? What would it mean to use evidence, creativity, and learning in this particular work? How will you ensure that experimentation and learning are an ongoing part of our solutions, and it's not on a single shot, but it's something that keeps adapting? And how is this work contributing to the social innovation knowledge base, so supporting the emergence of the discipline? I reckon you could, reading through those, and I haven't thought about applying them beyond a TACSI context, but I reckon it could lead for some pretty interesting thought experiments anyway, in engineering or social work.
But I think that it taps into that kind of thing when to move away from your technical focus or whatever it may be, but to force yourself to think about, what's the social outcomes, and who do we need to involve? I mean, they are key questions really, that if you run through those questions, I can see how you naturally develop, or you need to develop some of those mindsets and attitudes that kind of required. You need to have empathy for the end user and so forth, and also that humility and self-awareness. What's your thoughts, though, in terms of, as someone with a significant experience in social innovation and now involved in very complex processes of social innovation, but the idea of social innovation within higher ed? So I'm not familiar with Ashoka U, but obviously developed through or from Ashoka, and the idea was to make the universities places that could create change makers and get students to be able to engage in social innovation. And of course, at CQU, this is a key thing for our identity and what we're trying to do. What's your impression of that, or what's your sense?
It makes complete sense to me. It's a very exciting idea, I think, and from what I know about your institution, it's it kind of I can see that it could provide the kinds of challenges that could really lead to some of that higher level learning. I can also see how it could provide for some quite practical outcomes, good things for people through learning. And our real goal at TACSI is to mainstream social innovation. We think that it's, doesn't have the social innovation, doesn't have the prominence that technological innovation or scientific innovation on the kind of natural sciences might have, and we think it deserves and could bring societal benefits, not only social benefit but also economic benefit and planetary benefit if it were elevated. So yeah, no, I think it's a really exciting idea, and I think the important thing with social innovation is to keep that, to acknowledge the breadth of it. I think sometimes it quickly gets substituted for things like human-centered design with a social focus. And yes, you could do a human-centered design process under a social innovation banner, and we often do that, but I think there is something bolder and braver and more exciting in social innovation that's not like, of course there's a sort of moral purpose to it that is bolder. It's not pure process, and I mean, hopefully those questions give you a flavor for it, but I think it is about finding more intelligent solutions, I guess, to the number of challenges that we face as a society. And I think, kind of as COVID just demonstrating those, my small hope is that whilst this is, it's a kind of brilliant but awful, but brilliant sort of demonstration of the interconnectedness of everything. And how we're not purely economic animals, and how intricately connected sort of environmental and social and economic outcomes are. So, yeah, I mean, I think there is an opportunity to rethink some things, and I think that sort of the kinds of capabilities that come from social innovation, I think, could really support people to do that well.
Are you still kind of working with academics?
Yeah, absolutely. I mean, we are always interested in ideas and evidence and doing things well. So I think there's a number of opportunities to connect. I think one is one is we're kind of getting more open in sharing more of our learning and educational materials. So there's that piece. I think always in our work, we're looking to build on best evidence and thinking, and emergent thinking as well. So that's another opportunity. We have some long-term. Those projects tend to move quite fast, so sometimes that can be challenging in an academic environment. But we do have some longer-term projects, systems change projects, where we're trying to connect in academics and sort of also recognise academics as part of the system that can create the change in things like end of life, for example, or home and housing for older people. And I think those are sort of some of the opportunities to connect. Oh yeah, that's right. And then the last one I think is very interested in developing that evidence base for social innovation, and we've worked with a few people in that sort of place. We're really interested in how we can legitimize social innovation as an approach, so that it can get more traction and we can get a greater investment and better conditions for this to become business as usual.